Good evening and welcome to our COVID-19 update. I'm Ladi Akeredoluale. Here are the highlights at this hour. More states launch molecular laboratories to increase capacity for testing, just as more students test positive for COVID-19. Non-compliance to protocols worries authorities in Abia State, as traders also complain about the same phenomenon. And EU Trade Commissioner Phil Hogan to resign for allegedly breaching COVID-19 lockdown restrictions in Ireland. We start tonight in Gombe State, where Governor Inuwa Yahya has commissioned a molecular diagnostic laboratory with polymerase chain reaction equipment at the state specialist hospital to strengthen its fight against the COVID-19 pandemic. According to the governor, it's a proactive measure designed to gain positive outcomes against the disease. A representative from the Nigeria Center for Disease Control, the NCDC, says the state of the facility meets international standards because of its precision and versatility to diagnose other deadly diseases such as Lassa fever and viral infections.
Either in Abuja or Jos or anywhere else, we can now test here. And you have the records, and NCDC has it too, that Gombe has so far tested close to 12,000 samples. But with this one now, we can double that in a matter of days. So we shall continuously test, because the success of managing COVID depends on the numbers that you test. So we'll test more day by day, and inshallah we shall manage COVID better than before. We had to buy the machines from overseas, and coming here took a lot of time because of the lockdown, but nonetheless it came, and it's better late than never. At least we have it now. It cost about 121 million naira to bring it and put it up here.
In Bayelsa State, Governor Duoye Diri has also commissioned the state's Molecular Laboratory Research and Diagnostics Center. While unveiling the testing center located within the Bayelsa State Medical University Complex in Yenagoa, Governor Diri says the center is necessary in order to effectively tackle the COVID-19 pandemic. Speaking earlier, the Permanent Secretary, Ministry of Health, Dr. Inodu Akpoku, said the center can process 200 samples in 3 to 4 hours, stressing that with a disease that spreads quickly as COVID does, every hour is critical to containment. And still staying in Bayelsa, samples of 23 senior secondary school students out of 700 tested have returned positive. According to a member of the COVID-19 task force in the state, the students will continue with their West African Examinations Council exams, but have been separated from others for fear of community spread. Here's more from our correspondent in Yenagoa, Deborah Timiwood.
The number of active cases for the coronavirus in Bayelsa State as at this morning stands at 31. Now, the number has risen from 7 to 31, and Bayelsa State experienced 2 weeks where the numbers did not experience any significant increase. We spoke with the head of public health in Bayelsa State on the reasons behind this increase, and here's what he said.
As a state, we decided that as the students of the secondary schools are returning to school to write their exams, those exiting students, that it was good that we also retested all of them to be sure of their COVID-19 status. So that at the end of the day, we'll take a decision of isolating those people who are positive from the rest of the students and staff and the rest of the school community, and put them in an in-school isolation facility where they're separated from the rest of the students, and also to ensure that they can also write their exam. And so we've tested close to 700 students, and out of all of that, we've had close to 23 positive COVID-19 tests. All of those students so far have been engaged with, they've been counseled, and they've been separated from the rest of the students in the school. So there's actually no cause for alarm. The exams were not disrupted because we also ensured that in isolation they were also writing all of their exams.
The Bayelsa State COVID-19 Task Force also called for calm, asking residents of Bayelsa State not to panic, that they're on top of the process and they believe that the numbers will not skyrocket. As of today, there are 378 confirmed cases for the coronavirus in Bayelsa State, and out of that, 326 persons have already been discharged. The state has experienced 21 deaths. From Yenagoa, Dobra Timiwood for COVID-19 updates.
Still be staying in Bayelsa State, where we had told you earlier that it had commissioned its Molecular Laboratory Research and Diagnostics Center. While unveiling the testing center located within the Bayelsa State Medical University complex in Yenagoa, Governor Dwoye Diri says the center is necessary to effectively tackle the COVID-19 pandemic.
Onset, when we had COVID-19 to the point of collection of samples and testing of samples out of Bayelsa to as far as Irua in Edo State. It was not comfortable to all of us from here. There were some results that came in here a month after, some about 2 months after. And we were very determined to ensure that we had our own test center and laboratory. And I gave those matching orders to the Permanent Secretary, Minister of Health, and his team. And I'm happy today that there is one thing to give the matching orders, one thing to give the approvals, and the other one is the implementation.
This new laboratory means we can test for the virus directly in Yenagoa rather than spend time and money transporting samples to other states as we have been doing up till today. This laboratory has been adjudged one of the best COVID-19 laboratories in the country by the NCDC during the accreditation process, considering the very best and modern COVID-19 testing equipment we have put in place.
In Taraba State, the government says it will not in any way relent on enforcing the standards set by the Nigeria Center for Disease Control, as well as the Presidential Task Force on COVID-19 for its educational sector. This comes after an inspection tour by the state's Ministry of Education to check the compliance by schools across the state. Some public schools, however, improvised isolation centers to serve as emergency units.
Is the first outing of the State Ministry of Education to check compliance of schools, staff and students to the Nigeria Center for Disease Control's guidelines since the distribution of personal protective equipment to schools on August the 7th, 2020. The team is also subjected to temperature checks, just like everyone before being allowed into the premises, in addition to other safety measures like wearing face masks and washing of hands.
By God's grace, we have tried to educate them by telling them about COVID-19. They are students of a peculiar college and they are quite knowledgeable. They have also been able to read on their own, and we have told them a lot about it. So coping is actually not a problem. The compliance is easy with that knowledge that they have.
This institution, however, went further by providing an improvised isolation center to cater for any student who might develop symptoms or come down with a fever.
Because we have health mistresses, health masters, and so on and so forth, that they have been trained specifically for this kind of eventualities.
The inspection team appears satisfied and encouraged by the compliance level and healthcare initiatives.
All the schools we visited today, the principals are really proactive in their schools, and they're able to provide all that the government provided for them. We discovered that they're really making good use of it, and it is our own prayer and our own hope that the principals will continue in this good gesture by making sure that all that the government has provided for the fight of this COVID-19 in terms of prevention, we hope the principals will continue to follow the guidelines.
For now, everyone in Taraba State is hoping that the number of COVID-19 cases will not increase in the coming days, but experts say that will only be possible if all observe the safety protocols.
From the northeast to the north central, where in Kaduna State, schools are already preparing ahead, setting up isolation rooms within their premises where students who show symptoms of COVID-19 will be evacuated to continue with their WAEC papers. This is to ensure that such students whose health or behavior have been disrupted do not in any way affect or infect others. The government says it's also distributed free face masks, infrared thermometers, and hand-washing basins to schools across the state before the commencement of the examinations. Although no outbreak of COVID-19 has been recorded since the exams started about 2 weeks ago, in all the schools, students and staff are being encouraged to take safe and deliberate steps to keep the virus under control.
As you can see, there is great compliance of the COVID-19 guidelines. Our students come in early morning, they wash their hands, they use the sanitizer, and when you go to the class, you will see the spacing. The distancing is really maintained. The government has supplied the face masks, so every student has been given. There is no way a student will not wear a face mask. You cannot say he doesn't have, because we make sure we give it to every student. We have a class. We have converted a class into our isolation room. In case we met a student with a temperature, we'll get his paper and the student to that room to write the exam. We don't have any medical personnel, only that we have a health mistress that goes around to make sure that the students are fit.
From the north central to the southeast, where in Imo State, government through the Ministry of Health and the COVID-19 task force have carried out a total of 3,235 tests across the state since the outbreak of COVID-19. The state government, while intensifying efforts at fighting the COVID-19 pandemic, says it is scaling up testing by partnering with the NCDC through its mobile testing vehicle to commence community mass testing by September the 1st. Our correspondent, Itope Kutei, has more.
The figures of confirmed cases of coronavirus disease in Imo State today now stands at 523, with a total of 10 fatalities. This is according to the NCDC, while briefing newsmen earlier today in Owerri, the Imo State capital. The Commissioner for Health, Damaris Osunkwo, says about 52 health workers have tested positive for COVID-19 so far in the state. She says following NCDC guidelines directing states to test 1% of their population, Imo State, with a population of over 5.9 million people, is set to test about 59,000 persons across the 27 local government areas of the state through the community mass testing initiative of the state government. And at least 500 persons per local government will be tested. And this exercise will commence by September the 1st, 2020.
The next step we are going to do now is to initiate community mass testing. The NCDC guideline says that every state should test 1% of the population. And going by that, the population of Imo State is 5,964,000. So we're expected to test about 59,000 people in Imo State. And that is so enormous. No state has achieved it. But His Excellency went ahead to engage NCDC and KNCV from Netherlands. They are bringing in mobile testing vehicles starting 1st September. And we want to let the public, the Imolites, to know that we'll be coming local government by local government.
According to the Commissioner and other medical experts, contracting COVID-19 is not a death sentence, but they are appealing to indigents to continue to observe all the precautionary measures put in place by medical authorities to contain the spread of the virus. Such precautionary measures include wearing of face masks, maintaining social distancing, washing of hands with soap, and the use of hand sanitizers. From Owerri, the Imo State capital, Itope Kutei for COVID-19 updates.
In Abia State traders are appealing to the state government to go beyond enlightening the public and take firmer measures like shutting down the borders, limiting the number of market days in order to limit the spread of the COVID-19. Meanwhile, the government on its part says it is working hard at minimizing the spread of the virus in the state through the implementation and enforcement of its health protocols.
All borders are opened, and making the market daily markets is not helping issue. People from Abuja is coming in, knowing the number of cases in Abuja. People from Lagos is coming in. Like as of yesterday, I had the number of cases, new cases in Abia State here. Not that all of them are real in Abia State, but most of them are people from other states that comes in Abia State. Markets, people from Abuja will come home and they will enter this market. They communicate with others, whether with face mask or not. So to my own, if I'm to say, I would like our governor to take the market back to 3 days in a week.
Face masks are considered one of the most effective ways to protect oneself from contracting COVID-19. But it appears that some students writing both the senior school and basic education certificate exams in Niger State are not comfortable using the masks. They say it's really difficult to breathe with their masks on, an experience which they see as a distraction during the papers. Emperor Simon has more.
There is no doubt that the COVID-19 pandemic has changed the way people now live their lives. There are now new normals that people are expected to live with. One of such is the compulsory use of face masks, especially in public places. We decided to engage some students who are writing the senior school certificate examination and the basic education certificate examinations on what they think about the use of face masks. Some of them say it's not convenient for them, while others say that they are forced to live by it because they must protect themselves.
I'm in SS3, and during the examination, wearing the face mask is not that muchly convenient for me because the breathing of oxygen is not that free.
It's really difficult because it's hard for us to breathe. And so, though it's been advised that we should always be like removing the mask from time to time so that we can be able to breathe well. Well, the other protocols are okay, at least all for the safety of us.
So what do health experts think about the use of face masks?
Studies have shown that if, for instance, I put on my face mask regularly and others also put on theirs regularly, there's virtually almost like 100% surety that this disease will not be transmitted.
Niger State is currently battling to contain the spread of COVID-19, having recorded 237 confirmed positive cases with 12 deaths. In spite of the complaints, the use of face masks in the state still remains in force. Emperor Simon for COVID-19 updates.
Let's take a break. When we come back, we'll take a slightly deeper look at some of these issues, both of the students writing examinations and its attendant aftermath. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. According to the Nigeria Center for Disease Control, the NCDC, the use of a face mask and the other non-pharmaceutical preventive measures on COVID-19 will contribute quickly to controlling the outbreak. 252 confirmed cases were reported in the last 24 hours from 17 states. Plateau State had 50 of those cases, Enugu 35, Rivers 27, Lagos 26, the FCT 18, Kaduna as well had 18, Ekiti 10, Kano also had 10, Taraba 9, Anambra 8, same with Edo and Oyo. Delta had 7, Ogun had 6, Abia and Bayelsa had 5, and Ebonyi and Osun had 1 each. 707 discharges have been reported in the 14 states. Ondo, 528, Oyo 50, Kano 44, Plateau 19, Taraba 18, Ebonyi 8, Edo 8, Osun also had 8, Kaduna 6, Lagos 5, Ogun and Rivers 4 each, Ekiti 3, and the FCT 2. 52,800 cases have been confirmed, with 39,964 discharged and 1,007 deaths recorded in 36 states and the Federal Capital Territory. Let's talk a little bit more about this issue of students, the exams, particularly exit exams, and all the developments, new normal, shall we say, in that sector. Joining us from our Abuja studios is the Registrar of the National Examinations Council, NECO, Professor Godswill Obioma. Good evening, Professor Obioma. Thank you for coming in today.
Yeah, good evening.
Let's start from the issue of testing and students turning out to be positive. This is not an expected development. It's not something that examination bodies have had to deal with before now. How is your body taking the necessary lessons? Your exams haven't started yet, but they soon will. What lessons are you taking from the current exercise to improve yours?
Yeah, thank you very much. I would like to say good evening, viewers, once more. Our exams for the basic education certificate examinations commenced on Monday, the 24th. But the senior secondary school will commence on the 5th of October. I would say Nigerians, our exams have commenced. Regarding the question, you recall that I had, in a different media platform, shown Nigerians what we developed in advance, and I'd like to show it here too. What I'm showing here is what we did develop. Is a guideline for the conduct of exams and preparation of schools for the exams. And this guideline specifies what each stakeholder ought to do regarding school principals, regarding school managers, and so on. There are 7 sections, the candidate themselves, of course, security officials, our invigilators, and all of that. Now, we had also made preparations. We asked the schools to prepare spaces in their schools, which we call transit referral spaces, in the event that any of the candidates present the signs of the COVID-19 pandemic, coughing, sneezing, high temperature, and all of that. And so when that happens, the candidate will then be identified, or the set of candidates will be identified and taken to the transit center for more observation. And if it is such that she could take the exams, and special arrangements will have been made by the school for the exams to be taken by the candidate. But if it is such that the status will not permit exam taking, then of course the necessary need will be done. So we had done that. We had informed the schools well in advance, and the schools were well prepared. I personally went around some of the centers in Mina, 3 of them, the Federal Government College Mina, the Amina school, and of course the police secondary school, and things were in place. Things went normally, and of course we didn't have cases of students, students presenting the signs of the COVID. But
the other thing, sorry to jump in at this point. I'm sorry. Let me jump in at this point, Professor Obioma, and ask. All of these preparations involve greater costs for the schools and the examination bodies. For example, when you talk about staffing, more spaces are needed in order to comply with some of the guidelines, like social distancing. So you need more examination venues. You probably need more invigilators. And so how are you coping with that?
We plan for that. Recall that the exams are meant for exit classes. The ones that commenced on Monday were meant for exit classes in the junior secondary school, which means not all the students will be in school. So there are enough class spaces. And because the students had to maintain the prescribed 3 meters apart, there were about 25 people per standard classroom and not more than 50 for the exam hall. And so we had engaged enough supervisors where the hall is more in number. For instance, I saw in Federal Government College Mina, where you had a large hall and fewer students, supervisors, and 2 invigilators. So it didn't cost more. The cost was minimal for us, for instance. But for the school also, they had been prepared in advance. They had stakeholder meetings with the Federal Ministry of Education, the school managers, the commissioners of education, a month before the exams, and they had gotten prepared for this. And before the exams commenced, I'm aware that the school preparators, the commissioners of education, including, of course, the officials of the Federal Ministry of Education, went into the field to monitor that these things are in place. So we're on board, and we didn't have, our exams took off very seamlessly on Monday, and we've not gotten any negative reports that things had gone weary. Things are seamless, based on our guidelines, based on training, based on orientation we've given to teachers, to our supervisors, and all of that. And the exams, I'm proud to say, Nigerians, the basic education certificate examinations took off smoothly, and is going on smoothly today too.
Indeed. Thank you so very much, Professor Godswill Obioma, for joining us on the program this evening. It's been our pleasure to have you. Professor Obioma is the Registrar of the National Examinations Council, NECO. Thank you so much.
Yeah, thank you.
Let's talk now to Dr. Okute Ogenetega, who is a public health physician, joining us via Skype from River State. Doctor, thank you for joining us this evening. Thank you indeed. Let me begin straight away by asking about this issue of students testing positive during the course of these exit exams. Perhaps hindsight 2020, they should have been tested as part of the process of preparing for these exams.
Okay. Thank you for having me. Concerning the testing of students, we know currently as a nation, we're in the community phase of transmission. So we have a lot of asymptomatic cases. So it's not a prerequisite to conduct tests for these people if they follow the standard protocols that have been put in place by the bodies, the WAEC, and then the Presidential Task Force for COVID concerning reopening of schools, following the NCDC guidelines, where students will have to be screened at the point of entry, and they will have to wear their face masks continuously and appropriately. That way, we'll be able to mitigate to embarrass minimum some of this risk of transmission. Because if we were to do a random test, of course, we might pick more people. Knowing fully well that these students, they may not all be residents in the schools, like boarding. Some come from home and they have contacts with other members of the community. So testing for students should not be prerequisite before they write the exams, but they should be screened at the point of entry and daily. The screening involves use of non-contact thermometers to check their temperatures, asking for symptoms, and they should follow other safety precautions like washing their hands and then also possessing their personal hand sanitizer. So when they come in contact with high-touch surfaces, they can sanitize their hands. Also, keeping the safe distance. We help to curb the spread. Knowing fully well the means of transmission of this virus, then we can always halt the risk of transmission following these protocols.
The other thing, of course, from the reports that we have, for example, our correspondent in Niger State did report that quite a number of the students are reporting that the wearing of face masks is pretty difficult for them to do, and that it serves as an unwelcome distraction in the course of the exams. What can you tell them at this time?
Well, it's just one of the odds of this pandemic that we may have to bear if we have to go through this phase. We need to wear the face masks continuously and appropriately. And this is because we have a lot of asymptomatic cases. So you never can tell. It may be inconveniencing, but for now, those are the only existing tools we have to curb the spread of this disease. So it's just to employ them that, okay, during the course of writing the exams, you wear your face masks, but when there are breaks and you're alone in your reading corner, yes, you can take them off to get some fresh air when you're not in contact with others. But when you are in a hall or when you're within 2 meters with your classmates or staff or teachers, you should wear your face mask. It's uncomfortable, but it's something that just has to be done for safety reasons.
Okay, let's talk a little bit about testing itself. Earlier in the program, we had reported that 2 more states have launched their own molecular laboratories now, Gombe and Bayelsa. Other states have either launched theirs or they have prepared. In some cases, some have more than one. The problem now has moved from capacity to the actual testing. People are actually not coming out to be tested. What can you say about that?
Well, people not coming out to be tested, even before we go there, up till now, some people don't even believe that COVID exists. So not to talk about people coming out to get tested, that will always be a challenge. And it's a matter of we should be able to screen, and then when we screen, we can isolate and then notify. When people move around and they're asymptomatic, they don't need to be screened. Because if we move around and stick to protocols, use of face mask, keep social distances, we know that after 14 days, whoever is infected and is asymptomatic has limited ability to transmit this virus. So it's a matter of like common cold, it comes, take its natural course, and then it leaves. So at that phase, if we're able to keep to safety precautions and protocols, then we'll be able to mitigate the spread of the virus. So testing, yes, it can be good, but we should also note that we have a lot of asymptomatic cases. It's a virus, it can take its natural course. If we can test more people, good. But we should also note that it is more important to test the symptomatic ones so that we can triage and know who to treat.
Come this weekend, we are expecting to reopen the airspace for international flights. In your view, does this complicate what we're already dealing with, considering that we've got different dimensions of this? We've talked about the students who are doing exit exams. We've talked about the issue with testing and the fact that more and more people ought to be testing and why they are not, and more states are launching labs and all of that. But now we're bringing in people from outside. We expect that people from outside will come in, and there's a whole controversy over the kind of testing they do before they're allowed into the country. What's your take on all of this? Or should we just hold on?
Well, we can't hold on forever. And then we know that for every phase of opening the economy, it comes with its own risk. So, but the good thing is that there's always surveillance on ground, and there's always evaluation and re-evaluation. So when we take a bold step to open any sector of the economy, there are more hands on deck to evaluate what are the upsurge from making this decision. Is it something that we can exploit further, or is it something we have to halt? But if we don't make all these steps, then we remain in a fixed state, and that doesn't help. We don't know how long this virus is going to stay. So in our own bit, we have to try some certain measures so that we can know if what we have in place is functional, if we need to give room for more expansion in whatever we're doing, but we just have to give it a try. And most of these international flights, this prerequisite that the passengers will have to get some form of screening. I don't know, some might be PCR, some are just the antibody test, but they also do some form of screening before they can board that flight. And even within the flight, they observe social distances. All these rules have been laid out prior to this time. So the airlines are aware of the protocols that they should carry out while they are opening for their airspace for international flights. So of course it comes with risks, but we're trying to see as a body how we can mitigate this risk as much as we can. And then also we're studying the figures to know what decisions to make post-reopening the airspace.
You're talking to us, of course, from River State, the capital there. What's the situation in River State? We know that the government had been quite firm in some of the actions that it had announced earlier in the course of tackling this pandemic. But what's the situation there now?
Oh, well, every decision so far has come with its pluses. We must commend the government of River State. But so far, things are a little lax in terms of economic reopening. Some of these decisions may not be the safest, but of course, for economic reasons, they have to be made. And then We have the River State Public Health Emergency Operations Centers that, of course, it has different arms, the risk communication team, the case management team, which they are working insidiously and they're working, 247 to make sure that all hands are on deck to monitor every sector of the economy. Fine, we have more than one molecular lab in the state, so it's running, it's functional, our testing is top-notch, and then we also give room, for example, concerning this WAEC that is ongoing, the risk communication team, they provide supportive supervision to them, for them. Where they go there, where they see some gaps, they can give briefings, to the staff, to the principal, so that things can be done or changes can be made to make the place safer. But by and large, our economy, it's booming up, gradually. We're not saying that we are not experiencing the same community transmission that is happening in the country, but we're saying as a state, things have eased up while the surveillance and monitoring is still ongoing.
Finally, I must ask about you yourself and people like you, the health workers who are at the front line of this. The reports we have from other parts of the country is that you are really at it and some of your colleagues have been infected. The numbers vary depending on who you're talking to and where you're talking to them. What has been your experience dealing with this?
Oh, River State was still part of the world. There's an ongoing pandemic, so you don't expect that our case will be totally different, But in terms of infection of frontline workers, we've had cases where had some health workers being infected, but honestly, those in the fall, like, don't have recorded any case of those working in the isolation centers coming down with the infection. That's to say that our preventive measures, we try to follow due protocols as much as we can. And then, of course, when we have pockets of health workers get infected from different sectors, private sectors and other areas of the hospital, we try to cope as much as we can. We follow up. Our case management team is on deck. We have a very good contact tracing and line listing where we can categorize and then follow up infected cases so that we can prevent further spread. We line list their contacts and we chase them. So far, we're trying so hard, but honestly, we're just part of the global, part of the global community. So we suffer some crisis just like others do.
All right then, Dr. Okute Ogenetega, thank you so much for your time and your perspective on the program. Dr. Ogenetega joined us from Port Harcourt in Rivers State. Thank you so much.
Thank you. Thank you very much.
Outside our shores, come September the 1st, most public tertiary institutions in South Africa will be opening their doors to another batch of students in a bid to gradually reopen schools and complete the 2020 academic year. International students still stuck outside the country may have to wait a bit longer, though, as international travel is still not permitted until level 1 lockdown. South Africa is currently on level 2. Speaking at a press conference today, the Minister of Higher Education, Science and Innovation, Dr. Blade Nzimande, announced that the expectation is for the current academic year to end in February next year. So far, about 35 staff and 9 university students are amongst COVID-related deaths in the country. Dr. Nzimande says the reopening has been approved based on the education sector's COVID management plan, which prioritizes the health and safety of staff and students.
According to the criteria developed, I am happy to report that under level 2 of the lockdown, it will be possible for us now to allow for up to a maximum of 66% of students to return to university campuses. In terms of the criteria, the following categories of students will be able now to return under level 2. The first category of students who are now going to return as part of this 1/3, it's all groups that had been prioritized to return in level 3, but could not be accommodated due to the maximum campus carrying capacity having been reached. The second group will be...
The U.S. Centers for Disease Control and Prevention has changed its COVID-19 testing guidelines to say some people without symptoms may not need to be tested even if they've been in close contact with someone known to have the virus. Senior federal health officials close to the process say the sudden change in the CDC COVID-19 testing guidance was the result of pressure from the Trump administration. Our correspondent in Washington, D.C., Maria Bird, has more.
19 spikes across the United States. Cases President Trump provides these rolling hotspots exist. This is especially concerning for parents as schools begin to come back in session for the fall.
As parents, we are very concerned about our kids going back to school. Our top priority is safety first. So how are the state and local officials going to provide safety for our children? How are we doing this without a federal mandate? We're trying. I know that state and local officials are trying, but it's important for our kids to be in school. Parents are very nervous, they're upset, and right now is a very stressful time for parents as well as for teachers.
While concerns for the pandemic escalate, earlier this week,
and in the states with the lowest positivity rates, we also
plasma treatment that was approved by the FDA.
Today, I'm pleased to make a truly historic announcement in our battle against the China virus that will save countless lives. The FDA has issued an emergency use authorization, and that's such a powerful term, emergency use authorization for a treatment known as convalescent plasma. This is a powerful therapy that transfuses very, very strong antibodies from the blood of recovered patients to help treat patients battling a current infection.
Even though this was viewed as a win for the fight against COVID-19, in the last 24 hours, the FDA chief Han has apologized for overstating the benefits of the treatment. This calls to question whether the U.S. can really put an end to the pandemic. From Washington, Maria Bird, Channels Television News.
Let's talk to Maria now. She joins us from Washington. Nice to see you once again, Maria. Trust you're keeping safe.
Yes, nice to see you as well.
Let's begin with the students, shall we? Again, there's still the division, people being careful, people being worried about students resuming in the midst of all these conflicting guidelines. What's the situation with that?
Well, at this time, we're seeing that many schools, and specifically colleges, we are in the height of the beginning of the college fall semester. And just today, there's another university that had to close down its campus and move virtually because there was a hot spot of students contracting the virus. And they were concerned about this high number of individuals that had come back on campus and it potentially spreading beyond the 100 that had contracted it in just less than a week. So we're seeing, and as we mentioned in the report, we're seeing these hot spots, and a lot of that is due to the schools being reopened. And so parents are extremely concerned. They're relying on their local state officials to put some laws in place and put mandates in place. And many states are playing the politics. They're looking at whether or not President Trump is in agreement with them going virtual because he's made very clear that he wants all students back in school. But we know that when students get back to school, it potentially puts them at risk of contracting the virus.
The issue of the sudden change in the test guidance, which now means that even if you've been in contact with someone who's known to have the virus or who's exhibiting symptoms of the virus, you don't need to get tested. How did that come about?
Well, we know that there are many individuals across the U.S. and many individuals across the world that are asymptomatic, that have COVID-19 but are showing no symptoms. And so if you begin to take tests for individuals, and we're seeing an increased number of test availability, so many more people, even if they're not showing signs of symptoms, because they're trying to go back to work, their children are going to school, they want to get back to life, are going and taking the COVID-19 test and finding out that they too have COVID despite not having any symptoms.
Finally, I do want to ask about the blood transfusion. We had talked about this as a treatment earlier on in one of our interactions, but it seems as if now it's a go.
Yes. Well, as of right now, the plasma is a go, using the convalescent plasma as a treatment option. And they're saying if that is used within the first couple of days of someone having COVID-19, their ability and their success potentially of surviving the virus when they're in the hospital is much higher. And we know that has been something that they've been touting for quite some time as a potential a treatment that would be highly successful. But we also know that the FDA is now saying that yes, it can be used, but some of the potential success of it has been overstated, just due to the fact that people aren't saying that if you take this treatment, you will definitely make it out without any life-threatening occurrences as a result of COVID-19. But we also know that the president is potentially looking at having a vaccine approved earlier than expected, and potentially a vaccine that could hit the markets before we hit elections. So politics are high, but I think scientists are really asking the American people, and most importantly, the Trump administration, to be mindful of the science that goes into this and the safety and the welfare of Americans.
Thank you so much, Maria, for that update, and do continue to stay safe out there.
Thank you, you as well.
The European Union's Trade Commissioner Phil Hogan will be resigning from his position after he was criticized for allegedly breaching COVID-19 lockdown restrictions in the Republic of Ireland. Hogan had attended a golf dinner with more than 80 people in County Galway on August the 19th. He was also in the spotlight for not complying with quarantine rules when he arrived from Brussels. This comes as the number of COVID-19 cases in the UK rises by more than 1,000 in 24 hours. According to figures from Public Health England, 16 people have died, bringing the total death toll of those who died in the UK within 28 days of testing positive to 41,465.
Although France has been facing an increase in its coronavirus count in recent weeks, a French epidemiologist said the rise in hospitalization for COVID-19 remains under control. France has seen in recent weeks a jump in the number of new infections, with a post-lockdown 24-hour record of nearly 5,000 on Sunday. South Korea has ordered doctors in the Seoul area to return to work as they begin a 3-day strike in protest of several government proposals, including one to boost the number of doctors to deal with health crises like the COVID-19 virus. Trainee doctors have been staging ongoing walkouts, and thousands of additional doctors were due to stage a 3-day strike starting on Wednesday. A North Korean leader, Kim Jong-un, has called for prevention efforts against the coronavirus and a typhoon that's looming in the nation. An enlarged meeting of the Politburo of the Workers' Party took place on Tuesday amid a pandemic that is putting additional pressure on the North Korean economy, battered by recent border closures and flood damages. State-run television KRT on Wednesday showed Kim in a white shirt, not wearing a face mask, presiding over the meeting, laughing with officials and raising his hand to approve measures discussed. And Chile has passed the somber milestone of 400,000 coronavirus cases in the country as the South American nation gradually eases out of lockdown. As of Tuesday, Chile registered some 401,000 cases and 10,958 deaths. Outside of Santiago and its metropolitan area, residents have seen some of the stiffest lockdown restrictions lifted, but the capital still keeps some measures in place.
And with that global roundup, we conclude tonight's edition of our COVID-19 update. But you can get more on all those stories, as well as top stories on other crimes and other issues, business, politics, and sports, amongst others, from our website, channelstv.com. I'm Ladi Akere Duluale. Thanks for watching, and do continue to stay safe. Good night.